Federal health officials plan to start distributing nearly 800,000 additional doses of the monkeypox vaccine. The U.S. now leads the world in confirmed cases. The CDC reports more than 4,600 infections around the country, and more than 330 of those are right here in Florida. Health experts believe there are many more, though, that have gone undiagnosed. Dr. Mohammad Reza, an infectious disease specialist, joins us now live via Zoom to provide more information about this virus. Good morning. Thanks for being with us.
Good morning. Thank you for inviting me.
Doctor, would you explain how monkeypox is spread?
Yeah, so this is different from COVID, far different. It's less contagious, which is a very good thing. It's spread more so from direct contact with the fluid, the bodily fluids, from these scabs, from these lesions that we're seeing that the monkeypox can produce. It's also spread via respiratory large droplets. It's not something that hangs out in the air, but if you're in contact with someone for a prolonged period of time, in close contact, that's another way. Less likely, but that's another way. Other ways are if you're sexual active with anybody that has monkeypox and you come in, again, exposure to the fluid. And pregnant women can transmit this virus to the unborn fetus as well. Those are some of the main ways to spread this virus.
So it's interesting because we have heard of cases where someone has transmitted monkeypox to a relative like a child or even a spouse. That perhaps could have happened then, as you mentioned, through respiratory droplets.
It could have. So this virus will likely infect other people in your household. So it's not something where you can stand in a line with somebody and catch it. It's more so if household members do have this infection, they can come in contact with the bed linen that had any of the bodily fluids or any of the respiratory droplets that we're seeing. So it's highly contagious in a closed setting where family members may have been infected with it, but unlikely to spread so widely as we're seeing with COVID.
So I was listening to an interview yesterday morning with a man in California who caught monkeypox, and he just described this as excruciating. Said it was like basically putting your body in hot water and not being able to get out of it, and just constant, intense burning sensation all over his body. Can you explain symptoms of monkeypox?
Yes. So the initial symptoms can be you develop fevers, you develop fatigue, body ache, as well as headaches. One of the things that we look at with monkeypox, because it's very similar to smallpox that you don't see in smallpox, it's monkeypox, people have lymphadenopathy. So lymph nodes are swollen under here, under the armpits. And then you can develop these little pimples, almost like these little rashes that can become umbilicated, almost like a dot on top of a lesion, and it becomes pus-filled. And that can be quite painful and disfiguring. So although monkeypox does not tend to cause the death that we're seeing with COVID, these rashes can be quite painful and disfiguring. And one thing is they can happen on the palms and soles. Not too many infections cause that. And they can be in the inside of the mouth as well. And that's the point people are most infectious, when that fluid comes in exposure to other people and other bodily fluids or other material they may be using in the household.
So you mentioned smallpox, and I had heard early on when we started reporting about monkeypox that perhaps anyone who'd been vaccinated against smallpox would have some kind of immunity against monkeypox. Is that the case, is the first question. And the second, I mean, who should get vaccinated?
Yeah, that's a great point. So monkeypox is genetically very similar to smallpox, and the vaccines that we have for smallpox are being utilized against monkeypox as well. And the people that have previously received vaccine, we don't know if that provides a lifelong protection, but we hope. But people that should receive this vaccine, they should reach out to their provider or to the health department if they've been exposed by somebody that has confirmed monkeypox, or they're having signs and symptoms of monkeypox. So one of the important things, and one of the great things about what we have available from our data from smallpox, is we have antivirals to treat you if you do become infected with this virus, especially if you're immunocompromised, as well as the vaccines that are called post-exposure prophylaxis, where if you get infected, you want to get access to these vaccines within 4 to 14 days, because that can hopefully decrease the severity of this infection.
And very quickly, Dr. Reza, I mean, I know you're not at all involved in the distribution of the vaccines, but just personally in your profession, have you heard if there are any vaccines available here in our area? Because we've been having trouble, because we've been calling around, finding anyone who can answer that question.
Yeah, just like initially with COVID, this has been difficult to get kind of access to those vaccines. as well as a lot of the testing. And right now, it's just getting information out to people. But most people hopefully have mild symptoms, so the numbers are really being undercounted. So I don't know of specific people where you can access, but the health department is one you should reach out to, or your provider, if you do feel you have symptoms of monkeypox.
Dr. Reza, thank you so much for explaining monkeypox and particularly how it differs from COVID. We appreciate your time this morning.
Of course, thank you so much for having me.